The debate about whether healthcare is a human right or not has been waging for quite some time, but what is the difference between healthcare as a human right and health as a human right? Let's take a look. Well, health as a human right falls under what we call negative rights, which are mostly regarded as freedom from coercion and freedom from restriction or imposition by another party. So the freedom to be healthy really involves you doing your best to keep yourself healthy, based on your understanding, based on your education, based on your reasoning, and based on your resources to lead the healthiest life possible. That would be the right to health. The right to health care is quite different. It actually falls under what we call positive rights, meaning they're rights that require someone else to grant you something. You are by law or by moral code or whatever it is that's agreed upon, you are entitled to get services and goods from someone else as a matter of agreement that is enforceable in some way. So positive rights, if we take them to the extreme, at a certain point require coercion or restriction for the person entitled for that right to receive that right, and the coercion and the restriction is on the other person to provide the entitled with that right. So very simple, the right to health is the right to live one's life freely and free from coercion or restriction to lead the healthiest life possible. The right to health care actually requires someone else to provide that service by obligation to the person who has that right to health care. So let's take a look at the mechanics of what healthcare as a human right requires. Well, first of all, it requires a system that forms that agreement for you to receive that healthcare. That system will have to obviously create the infrastructure to deliver that healthcare, or at least rely on contractors that it will pay to provide that healthcare. And then ultimately, because it is a right, meaning it is indisputable or it is very difficult to dispute, it is actually someone else's obligation to provide that right to you. So that means that the system will also have to form an enforcement arm to make sure that those services are provided, especially around the less lucrative or less profitable areas of healthcare. So what's the problem with healthcare as a right? I mean, everybody gets healthcare, right? So let's look at the mechanics of this. Well, if everybody gets healthcare, that means that healthcare is rationed, meaning everybody gets a little something that's decided by the central government, and that is what they end up getting. There's really nothing else they can get. They can only get those services that were decided, that are included in that right, in that Bill of Rights of healthcare. So the central government or the managing authority will decide what goods and services you will receive as part of that right. So services are limited. Most people get the very basic package. The very rich can afford more, but most of the people are not very rich. So most people get sort of basic healthcare, whatever is considered healthcare, and that's pretty much all they get. That's what they have to live with. Now, when we look at enforcement of healthcare as a right, that system obviously consists of a very large bureaucracy. That bureaucracy needs to oversee, especially the edge cases where healthcare is denied for whatever reason, usually for money or convenience. And that system is very cumbersome by default, very, very bulky, very large. And that will result in a lot of hiccups and a lot of frustration. So imagine a large system trying to coordinate this provision of this basic human right to millions or hundreds of millions of people at the same time. That can get very cumbersome. Imagine calling their customer service. I didn't get my right. Talk to a bureaucrat unaccountable to you who may or may not be able to do something, but ultimately those wheels are going to grind very, very slowly, resulting again in much frustration, very slow delivery of results, whether it's healthcare, whether it's paperwork, whether it's actual results, test results or whatnot. And there's going to be a lot of red tape in getting the services from the system, from the provider to the consumer, which is the patient in that case. Another thing that's pretty obvious, people that are coerced to provide a service are going to be, let's just say, less than motivated to provide the best service or do their best under duress and under those conditions. Now, some of them may provide excellent service, but some may become cynical and may burn out or may resort to other types of unsavory behavior in providing healthcare. And last but not least, a government-given right is also an obligation, and not only on the person who provides that right to the consumer or the citizen. It is also an obligation sometimes, or it can be turned into an obligation on the citizen to receive that healthcare. So suppose the government decided that the citizens should all receive a certain medication or use a certain device, and you have a right to healthcare under that government, the government determines what it is that you're entitled to and what is your obligation in order to receive healthcare. So those things can turn pretty coercive, and people may be forced under those conditions to receive treatments or medications or services that they don't really want or strongly object to on any kind of basis. But that would be par for the course for a system that sanctifies healthcare as a human right. Ultimately, this right is an obligation on another human being, or sometimes the recipient of that right, to behave and act in a certain way in accordance with the edicts and the decrees of the bureaucracy. If you've enjoyed this video, share, like, and subscribe. Let me know in the comments section. Do you think healthcare is a human right, a basic human right? Or is it a service that a person can actually contract, or maybe a little bit of both? Maybe a little bit of a right under very extreme circumstances and something you can actually buy and bargain for in the free market, just like any other goods and services. Also, don't forget to hit the notification bell for notices of future episodes. More great content coming your way right from this channel. Thanks for watching, and God bless.